Treatment Energy Core Faculty for the College of Health and University appointment at Ross University School of Medicine. And I wanted to go over some important eye conditions that affect people, individuals at younger ages. So you're more likely to see this in the first couple of years of life more than at older age. Although this is something that may be seen later in life. So these are the conditions I'll be going over. So amblyopia, lack of development of clear vision in one or both eyes for reasons other than an eye health problem that cannot be improved with glasses alone. So a lot of times we use the term lazy eye in a very general context, but the reality is amblyopia is lack of development of clear vision in one or both eyes. Doesn't necessarily have to be from a lazy eye. So amblyopia, cause of the suppression, refractive, results from an uncorrected high prescription in one or both eyes, which is something I have, and I've actually witnessed toddlers that have gone through this. Strabismic or strabismal is results from a constant eye turn-in for one eye, and then deprivation results for impaired results from impaired or lack of vision. So strabismus, on the other hand, is hypertropia and cross-eyed. Misalignment of the eyes causing one eye to deviate inward, which is called esotropia, toward the nose, or outward. So inward is esotropia, outward is exotropia, while the other eye remains focused. Normally, this is outgrown by 3 months of age, even if the baby has it. But I've seen it actually it actually go on for further time. So strabismus, although, as I said, however, is something that is seen in common with premature children. Frequency is more common in older children. It can be as a result of traumatic brain injury, retinopathy of prematurity, retinoblastoma, and cerebral palsy. Also can be a result of stroke or head injury. So any sort of concussions that might lead to inflammation of the brain, and any sort of head injury that may be caused by something something that they might have been exposed to. And then stroke is more in advanced adult age, and some of these eye conditions are very much indicative of brain lesions. So if it develops at a more advanced age, then you want to be looking for stroke etiologies and what part of the cortex it's affecting. Again, there's about, to be exact, 6 muscles that control the eye. The superior oblique, inferior oblique on both sides, and then there's a muscle in the middle, making it 6. And then it's interesting if you look at it in anatomy. If you haven't gotten a chance to look at the eyeball, it's interesting. Again, one eye may look straight, other looks in another direction. Work with the visual cortex to focus eyes correctly. What's the treatment? Well, as I said earlier, glasses can lead to correction if it's mild. Sometimes what's recommended, and I've heard this a lot, is an eye patch over the stronger eye to strengthen the muscles in the weak eye. So surgery on the eye muscles. There's a final type of condition I want to go over, which you don't necessarily hear about too much, but that's called convergence insufficiency. And what is interesting about human vision is that you can actually take, and people don't think about this, but it's interesting how our vision is coordinated between two eyes, because technically we have two sources of vision, two eyes. So how that convergence, how it takes place with the visual outputs from the brain is called binocular fusion, and it's an important characteristic that we have. Without the ability to fuse and converge, you don't get the full visual. What are some of the symptoms? And it's interesting, it's important to go over symptoms because convergence insufficiency can be understood from squinting, rubbing eyes, or closing one eye. Well, what's the good news? I want to end with some good news, is that it does not lead to permanent blindness. So this is something that evolves and can disappear once they go into childhood, from infancy to toddler to childhood. And so these are the main eye conditions. Thank you for listening.